the website medicare.gov is helpful as well. Please go to that website. I will be sharing notes after class with some of these links. So I will send those along in the class notes after class here today. So you can write them down if you like, but you don't have to. So again, the 4 parts are part A, B, C, and D. A consists of everything to do with hospital coverage, anything to do with the hospital coverage. If you are in the United States and have been working for 10 years or more, that has been getting pulled out of your paycheck for pretty much your existence of your working career. And that's why there is no cost to Medicare Part A. Part B is your physician's costs, anything to do with your physician and also some clinical settings. We'll talk about that. And Part C is Medicare Advantage. That is something that you will have to go out to into the private marketplace, just like you're familiar with in your employee situation, that you go and you shop for different coverage, PPO, HMOs, different doctors, different plans. And you would have to purchase those from Blue Cross Blue Shield, Humana, UHC, all the different healthcare companies. Those are vetted by the federal government. So you will have to go out and purchase those. And Part D is your drug or prescription. That part you will have to have as well. So those are the 4 main parts of Medicare, and we're going to dive into each section here today. And this class is for you. So if you do have questions, hopefully I can answer them. If I can't, there might be some other learners on the call here today that might be able to help us out. So Medicare Part A is if you've worked in the United States on 3 months before your 65th birthday, you'll get a nice letter from the Social Security letting you know that you are automatically enrolled in Social Security. If you're an employee of a company, you're still working and receiving benefits through that corporation, then you don't need to do anything at this point. But Part A is you are automatically enrolled in that. So Medicare does not cover long-term care, such as extended stays in nursing homes. Individuals can consider purchasing long-term care insurance if this is something that you want to plan for. However, in general, what is covered by Part A is generally hospital-related, immediate or acute care of injury or illnesses. Most beneficiaries will pay nothing for Medicare Part A. Again, that's automatic when you turn age 65. And that's something you've paid into all these number of years. So as you know, we pay taxes all these years. Well, Medicare Part A is part of that as well. As long as you've worked 10 years in the United States in your lifetime, you will generally pay nothing for Part A. If you do not have this work history, you can purchase Part A as long as you've been a legal resident or a green card holder for at least 5 years. So that is in Medicare, the cost section. Again, you can go to medicare.gov and read up on Part A, but it does talk about that. If you do not have 40 quarters, that's what you need. You can pay a premium as of 2021 this year. The cost of Part A, if you have not worked 10 years in the United States, is $471. If less than 30 quarters, it would be $259. So that's what you would need to pay. When do I enroll in Part A? Again, you'll be receiving a nice letter from Social Security a few months before your birthday, usually 2 to 3 months before your birthday, inviting you to enjoy all the benefits of Medicare Part A. So what does it cost? Again, there is no cost to Medicare Part A, but there is a deductible that has to be met, and that's $1,484 every year. If you stay in a hospital for longer than 60 days, anywhere from 61 to 90 days, there is a $371 cost, and that is a daily rate. And then anything beyond 90 days is $742 for that cost. If they discharge you from the hospital and you go to skilled nursing or rehab center, they will pay the first 20 days, so there's no cost to you. Beyond the 20 days, there is a charge of $185.50 for that charge beyond the 20 days. And that goes anywhere from 21 to 100 days. Okay. Any questions on that? Just so we're clear. Okay, any questions on Part A? That is the hospital cost. All right.
Yes, I have one.
Yes, please.
Those amounts that you listed, those are daily, right? Daily costs?
Correct. Yes.
Okay.
Yep. Medicare Part
Lee, in Part A, I seen where it said meals. What is that all about?
meals.
You had meals listed.
Oh, here?
Yeah, go back. Yeah. Regular
Yeah,
meal.
That's what it covers. Part A, well, so if you're in a hospital, it covers semi-private room,
Oh.
regular meals, medication, skilled nursing, home health care, and hospice care.
Oh, okay.
So it does
Okay.
cover those things. Good question. Thank you for calling me on that.
Mm-hmm.
Any other questions on that? Those are really important. So you do get fed while you're in the hospital. No grocery shopping from your hospital bed. I don't know if Amazon delivers there. All right. Part B, which covers doctor's visits, outpatient care, home health care, durable medical equipment like oxygen, beds, things like that, and preventative care. It does not cover dental, hearing aids, hospice care, and prescription drugs. Does not. Okay. Those are things that you can purchase through the Part C plan, which we'll talk about in a minute. Okay. Medicare Part B coverage provides you access to a variety of outpatient medical services. Part B also covers preventative care, including flu shots, colonoscopies, mammograms, and more. It covers ordinary outpatient things like doctor's visits, lab testing, home health care, ambulance rides, and some chiropractor care as well. So you need to, if you're going to a chiropractor, you need to just ask them if they do take Medicare Part B. However, Medicare Part B also covers services that sometimes occur in hospitals. This includes things like physician services, radiation, chemotherapy for cancer, surgery, diagnostic imaging, medical equipment, and even dialysis for failing kidneys. Part B will also pay for drugs administered in a clinical setting, such as osteoporosis injections, infused drugs, antigens, and insulins that is used in an insulin pump. So Part B does cover that.